Thank you for listening to Depictions Media Radio. Okay, our next segment is improvements to the British Columbia Emergency Services, ambulance services, fire department, fire, and, of course, 911. There was an announcement made about allowing 911 callers to hang up after they have delivered services. This means that the police, the ambulance, or the fire department are en route, and at this time, the 911 caller is allowed to leave the call. And as you hear, one of the reporters in this next segment is going to say, well, how can we leave people to their own devices at one of their worst times? There's a lot to be said about having that 911 caller stay on the line with us while we're waiting for services to arrive. We're waiting for that professional to get there to deliver assistance to us. It can at times bring us back out of a panic and help us along and keep us cool-headed so that we can deliver a statement or help our loved one in a time of need. So Adrian Dix is going to be asked a question about that, and you'll have to listen closely to what his answer is. But the idea of improving and helping deliver more services and make it easier for ambulance drivers and fire departments to be able to get to calls is an excellent thing, and it does need improvement. We do need to see more services delivered, and we need to see more mental health calls delivered to someone other than the police. So we need to listen closely to this next segment and hear what Adrian Dix and the ambulance drivers and have to actually say about delivering services to us to keep us safe and healthy.
Good morning. I'm Adrian Dix. I'm BC's Minister of Health. And before I begin, I want to acknowledge the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be speaking to you from their lands today. I want to recognize they're both to my right today, the two people who will be joining me for today's announcement. Ryan Sinden, the Chair of the Emergency Medical Assistance Licensing Board. Welcome, Ryan. And Leanne Heppel, the Chief Ambulance Officer at BC Emergency Health Services, who's with us as well. And they'll both be speaking in a few moments, or as we like to say, after I'm finished. I'm really grateful to both of them for their dedication and work, which reflects the dedication of work of everybody involved in emergency care in our province. I'm tremendously proud of the work they do every day, the work in particular of our team at BC Emergency Health Services, but also, like all British Columbians, proud of the work of all our first responders in the province. All they do every day to keep us safe. We are honored to be working with them. I'm announcing the next step in the government's work to improve BC's health services for people and families in emergency situations. The province is expanding the care that both paramedics and first responders can provide. When you call 911 and it's an emergency, you need to know that first responders can help you with every health intervention they are trained, licensed, and able to deliver. Our approach will deliver a more effective service for patients and families depending on it. It will also empower first responders to do what they do better than anyone, save people's lives when everything is on the line. I'm delighted to announce these improvements. talks have involved many health ministers over many years to talk about these issues of scope of practice. It has taken a lot of hard work and good faith from the parties, from everyone here today. Once the changes are implemented, paramedics and responders will increasingly be able to help patients on scene. For paramedics, this means the ability to provide more life-saving interventions, which at various licensing levels can include needle decompression for major chest trauma to support breathing, using portable ultrasound to better assess patients and inform care decisions, enhancing airway management skills, and providing life-supporting or sustaining medications during transport. These changes are further supported by increases to the care that first responders, such as firefighters, can provide, including additional diagnostic testing, such as blood pressure and blood glucose while on scene, that can better inform paramedics, administering to deal with life-threatening allergic reactions, administering care, supporting the preparation and packaging of patients for transport by paramedics. What this means for people, and that's the most important thing, is when it's a life and death situation, first responders who respond to medical emergencies will be better prepared and trained and equipped to manage it all and get you through the most critical moment of your life. We're also increasing support for first responders. Expanding the scope of paramedics and first responders will benefit thousands of British Columbians. We know our emergency service providers will come face-to-face with challenging situations, and we need to be there to support them, just as they are here for us when we need them most. That's why today I'm also announcing that the BCEHS and the ambulance paramedics and dispatchers of BC, that's QP Local 873, have worked closely together on immediate actions and a long-term plan to increase mental health supports for frontline staff. Immediate actions include increased clinical supports and resources through the Critical Incident Stress Management Program to better support and help frontline staff and their families navigate resources available to them and make it easier to access important mental health services in a timely manner. Adding resources for all BC EHS staff and their families to the network of trauma-informed and occupationally competent counselors who provide psychological care. And create a BCEHS and ambulance paramedics and dispatchers of BC joint committee to implement collaborative recommendations on a comprehensive short, medium, and long-term psychological health and safety strategy. In addition, as announced in July 2021, BCEHS will be conducting a joint workload review with the ambulance paramedics and dispatchers of BC to better understand and address resource and workload levels to support greater patient care and the wellness of frontline staff who provide that crucial care. Today marks an important milestone in our collective effort to enhance British Columbia's emergency healthcare system. When we need help, we call 911, and we must know that help is on the way quickly, and that when that help comes, we need to know we are going to get the best care possible by highly trained and well-supported emergency healthcare workers. That's the commitment. That's the commitment we made in July when we announced that Ryan and his team at the EMALB would be providing a report and make recommendations, and the decisions and the announcement we made with respect to scope of practice reflect those recommendations. That's the commitment we made. At the same time, when we announced the changes in leadership at BCEHS, we have a Chief Ambulance Officer, Leanne Heppel, who you'll see in a few minutes. We have a new board chair who has led these efforts over the last few months with Leanne, Jim Hsu, who's done an exceptional job and doing an exceptional job. We have a new board. We have supports for that board. We said we'd hire 85 new full-time paramedics. We've hired 85 full-time paramedics as of November 30th, 2021. In metro areas such as Vancouver, North Vancouver, Port Moody, Burnaby, Surrey, Langley, Richmond, Abbotsford, Kamloops, and Prince George. We said we'd hire 30 full-time dispatchers, and we, in fact, have hired 65. 30 dispatch staff are finished training and are beginning to be scheduled into BCEHS dispatch. 35 have started training and will be ready to work in BCEHS dispatch starting January and February of 2022. In addition, recruitment started for another 30 other dispatch staff. Their training is expected to get underway in February. We said we'd be getting 22 new ambulances. 9 of the 22 new ambulances are currently operational, with the remaining expected to be in place by the end of 2022. Converting 22 rural ambulance stations to 24/7 Alpha stations. That number has been increased to 24 after the July 14th announcement. What's happened? We've converted 24 ambulance stations from on-call paramedic staffing to 24/7 stations to enhance ambulance coverage for those communities, resulting in additional full-time positions being added, delivering emergency health services and ambulance services in rural and remote communities in BC. And we've also, as noted today, made a commitment to address some of these issues of scope of practice through Ryan Sinden's work and the work of the Emergency Management Board, and those recommendations have been put in place and are being put in place in the coming months. And finally, we're working together with the ambulance paramedics of BC to improve mental health services and support for ambulance paramedics and dispatchers across BC. In short, we made a series of commitments at that time that builds on the significant increase in the move to a much more full-time ambulance service than we've had before in our province. The move before all of this from $424 million in annual spending in 3 years on ambulance services to $559 million. Other than mental health addictions, the most significant increase in funding for any service. The challenge is real. What we've seen in the last year is an increase not just in ambulance calls overall, more importantly, the increase in what we call purple and red calls, the most serious calls that the emergency health services deals with. And we are responding to that the best way we can by improving services, by supporting our ambulance paramedics, by supporting first responders. We're doing it by adding resources where resources are needed. We're doing it by supporting ambulance services and transforming the ambulance service, especially in the interior of British Columbia and the north of Vancouver Island. And we're doing it for one reason. When you call 911, you expect to get a responder. You expect to get an ambulance if you need an ambulance. You expect, of course, if you need fire or police, to get them as well. These changes, these resource implementation, these policy changes, this change in our relationship and the work we're doing with ambulance paramedics and firefighters and others will create a better system for everyone. And that's what everyone expects. I don't expect everyone to make judgments about how people work together or how systems work. But they need to know that when they call 911 and need an ambulance, they'll get an ambulance and they'll get other supports beside. It's my honor now to introduce Ryan Sinden. I think that I know that when Ryan agreed to become chair of the Emergency Medical Assistance Licensing Board back, when was it, 2019? 2019, let's just call it pre-pandemic, I was confident he'd do an exceptional job, and he has. He's shown great leadership at the board. When we asked him to take on this work in July to move this process that people have been talking about for a long time forward, he and the whole team at the board took it on with energy and enthusiasm, and it's my honor to introduce Ryan today. Ryan?
Thank you, Mr. Minister. Thank you, Minister Dix. Following the request for scope of practice change recommendations on July 14th, the board reached out to our stakeholders with an unprecedented and substantial ask. We sought input on what scope changes were most important for their needs, why they needed the changes, and the impact of those changes on patient care. We also needed to know what medical evidence supported the changes that they were requesting, and we needed to know it right away. Every one of those groups met that challenge and showed up in a meaningful way with thoughtful and comprehensive submissions. This consultation was a critical step. British Columbia is geographically vast, with a diverse population made up of distinctive communities. The needs of one stakeholder are not necessarily shared by that of another or relevant to another. I believe that the value of the feedback from these stakeholders Medical Assistance Licensing Board, I would like to take a moment and recognize the efforts of these groups who contributed to this important initiative. They include the Ambulance Paramedics of BC, the BC Professional Firefighters Association, BC Emergency Health Services, the Fire Chiefs Association of BC, the First Nations Emergency Service Society of BC, industry, search and rescue, as well as the training institutions of EMAs. I would especially like to acknowledge they are a small team with a monumental job and put in an immense effort to ensure that this project was successful, and for that, the board is profoundly appreciative. These recommendations are robust and will enable license holders working in all environments and at all license levels to care for their patients better than ever before. Quality of care, consideration of evidence, and patient safety were the major lenses that we use in the consideration of these recommendations. This is an exciting and important moment. It represents the most significant change in out-of-hospital care over the last 30 years. As a paramedic, I'm excited to deliver more comprehensive assessments and life-saving treatments to my patients. As a firefighter, I appreciate the increase in diagnostics to better inform incoming paramedics of patient status, as well as provide new, time-sensitive treatments to patients in need. As an educator, I welcome the opportunity to design more fulsome training that will incorporate the new diagnostics, skills, and therapies to improve clinical care. And finally, as a British Columbian, I'm reassured that when somebody calls for help, responders will show up with more tools and training than they have ever had before. Pre-hospital transport medicine has long been recognized as a vitally important healthcare specialty that impacts everyone. My board colleagues and I are really excited to see the frontier of emergency health services in British Columbia take a major step forward. Thank you. I'll now pass it on to Ms. Leanne Heppel, Chief Ambulance Officer of BC Emergency Health Services. Thank you. Thanks, Leanne.
Thank you, Ryan. Minister Dix. I'm Leanne Heppel. I'm the Interim Chief Ambulance Officer for the BC Emergency Health Services. As Minister Dix said, we at BCEHS have been taking action to strengthen our ambulance services. We've made good progress with adding more paramedics, call takers, dispatchers, ambulances, staff for the whole service. And I know these resources will help improve our ability to respond to those in need for emergency health services. The scope of practice changes today related to paramedics being announced are very important for improving care for patients. In the early days, the focus of our ambulance service was on transporting patients to hospitals. Over the years, paramedicine and our services have evolved, and I can attest to that firsthand as a trained critical care nurse, riding on ambulances and working with our staff and watching the skills that our paramedics provide to patients. With more advanced training, paramedics are providing more interventions and types of care that can make a huge difference in the lives of patients. Standardization and advances in practice mean more sophisticated care options, both at the scene and on the way to the hospital, while real-time information can also be relayed to emergency departments if needed. Increasing the scope of practice of paramedics is an important part of this evolution in paramedicine in the province. And we at BCEHS are looking forward to integrating the practice changes so we can provide even better care to our patients. We'll be working closely with the government, the unions, first responder partners, the licensing board, municipalities, training institutes, and others involved in this important new step. We already have an important relationship with first responder agencies. When our medical dispatch staff receive a 911 call that is potentially life-threatening or urgent, BCEHS dispatchers automatically notify our first responder partners. We very much appreciate this important partnership and look forward to collaborating even more closely on these scope of practice changes announced today. I'd like to close by thanking Ministry of Health for all their support and increasing our paramedic scope of practice to provide even more life-saving interventions and care for patients across British Columbia. Thank you.
You see, I'm going to get my glasses.
As a reminder to media on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Rob Buffum, CTV. Please go ahead.
Hi.
Oh, hi, Minister. Thanks for taking my call. My call actually relates to booster shots. As you'll be aware, NACI's made the recommendation that they be given to folks younger than previously. I'm just wondering, in light of Alberta's decision about the timing for booster shots, would British Columbia consider changing theirs, especially in light of Omicron?
Well, Rob, we made our announcement. I know that other provinces have made their announcement more recently. It makes it seem like they're moving more quickly. We made this announcement weeks ago and have just been proceeding to implement our booster shot program. I just want people to understand where we are right now. So 6 months ago, around June 1st, approximately 109,000, I think it was, second doses have been put in place. 209,000, I apologize. And today, 470,000 booster doses have been put in place. So 6 months later, so within that. So we're actually, for many people, the majority of people, in fact, receiving booster doses so far were within the 6 months. The reason we did that is because of when second doses happened. The largest number of second doses happened in the second half of June and then July and August. So we're going to see a big uptake in booster doses in January and February, and that's what we've been preparing for. But we wanted to get ahead of schedule. We're ahead of schedule, people, and we're well within these guidelines. These guidelines support the program that Dr. Henry, Dr. Ballum, and I announced some weeks ago, and so we're proceeding. What NACI recommended today was that for people 50 years and older, including adults living in long-term care homes, all long-term care homes have been completed and were completed at the beginning of November. And other congregate living settings that provide care for seniors, all assisted living, all independent care homes have already received their booster doses in BC. They also talked about the need to provide booster doses for those who receive viral vector vaccines, and that is happening. So we're proceeding. It's not what we say we're going to do, it's what we're doing in BC, which is delivering booster doses starting at 6 months. And the focus in the early stages, as recommended by NACI, has been vulnerable people. So as of today, 47% of all those over 70 have already received their booster dose. All long-term care, assisted living homes, many healthcare workers. We're taking a whole all-of-community approach in Indigenous communities, which you'll remember got first and second doses earlier in the first time around. All of that work is happening, and you see the results of it on the ground. To achieve what we need to achieve, which is to provide for those over 50 those booster doses at 6 months, we are enhancing our system of administering shots. So we're involving community-led pharmacies who have been busy, of course, delivering about 1 million influenza vaccinations. But right now, 200 community pharmacies are involved in our COVID-19 vaccination program. By January, that will be 1,000, and they'll have a leading role incorporated in our IMSS-BC network. So when you book an appointment, you can book it at a clinic, you can book it at a pharmacy at that time. So the NACI recommendations support what we're doing, and we're just proceeding. And right now, we're ahead of schedule. We'll be more challenged because there'll be more booster doses to give, more people passing that 6 months mark in the next 2 to 3 months. And Dr. Ballum is putting the team together to meet that challenge. So we're obviously pleased with the NACI recommendations. We went forward some weeks ago well in advance of these recommendations, and the NACI recommendations, not surprisingly, have supported our direction. So my message to everyone is when you're invited to get a booster dose, get a booster dose. And I want to say finally, Rob, this is important, when on November 1st, and this is the result really in large measure of two sets of measures. One, the requirement, the mandatory requirement for vaccination of healthcare workers and booster doses in long-term care. We've gone from 23 outbreaks in long-term care on November 1st. They were smaller than in Wave 3 and in Wave 2, but nonetheless 23 outbreaks to 2 today. There's only 2 active outbreaks as of yesterday, one at George Derby and one at Peace Villa in Fort St. John. George Derby is in Burnaby, which demonstrates why these steps are necessary and the value of immunization, the value of COVID-19 vaccinations for everybody.
Rob, did you have a follow-up?
I do, and I take it from that response that you're not considering lowering the age of eligibility or the timeline. Now, correct me if I'm wrong on that, but I'll assume on your response you're not. I guess my follow-up would be, do you have concerns with the number of cases we're seeing within Island Health? This week it sort of popped up as having the second most active cases. I heard from Dr. Stanwick yesterday that that increase in cases was fueled in part at least by a religious-related event in the Courtenay area. So I guess I'm wondering if you can comment on, are you concerned about what we're seeing on the island? And specifically, what details can you tell us about what I gather is a significant number of cases in a religious-related event in the Courtenay area?
Well, you asked a question about age, and just to be clear, we delivered first and second doses, as everyone will remember, generally by age. We started with those most vulnerable, so in long-term care, assisted living, healthcare workers, and then we moved on by age, and you'll remember we came down the age threshold. So when NACI recommends they should be offered 6 months after the completion of the primary COVID-19 vaccine series, meaning I got my second shot on July 13th, so I'll start to be eligible after January the 13th of 2022. In my case, the priority was by age and by clinical vulnerability. And that's what we're doing now. We're doing it by age and clinical vulnerability. And so we're delivering on these recommendations, and we're in advance of them. As I say, there were about 209,000 people who got their second dose as of the first week in June. It started to pick up after that. And right now, 470,000 third doses tells us we're ahead of schedule. So the reason why you see the age work as it's working is because younger people tended to get their vaccine later, and they're 6 months, therefore 6 to 8 months will go later. And starting at 6 months, we're hoping to meet that target practically on the ground, and we're not just meeting it now. We're exceeding my expectations for booster doses. And you see the impact of that, the positive impact of that action in long-term care. So the NACI recommendations fit with what we're doing, and we're just going to continue to proceed. And we want to thank our community pharmacies for being a part of that. With respect to Vancouver Island, I think what you see, you're right, there is cause for some concern. Vancouver Island has had either the lowest or amongst the lowest levels of transmission of COVID-19 since the beginning of the pandemic. Amongst our 5 regional health authorities right now, Vancouver Island's in second place right now. Rob, so or has the second highest rates of transmission. It's actually behind Interior Health right now in terms of test positivity from COVID-19. Of course, well behind Northern Health, which has the highest levels. So what that tells us is that we've got to continue to increase our vaccination efforts, increase both if you're called for a booster dose, to get your booster dose, to get your, if for whatever reason you haven't got your first dose immunization, to get that. And I believe that will continue to have an impact, but also to follow public health measures and to be cautious in these times. As I say, Vancouver Island's done extremely well relative to any other health authority throughout the pandemic, but right now, there are more cases on Vancouver Island. That should always be a cause for concern. It is for us. And that's why we need more people to get vaccinated. And that's why we need people to follow both public health guidance and measures. That means washing your hands, wearing a mask in indoor public spaces, and all of the other measures that are put in place. And as we get together as communities in the holiday season, in the Christmas season, and other holiday season, we need to be cautious and in terms of and to follow those measures, especially now, because no one wants this to be a period where we see cases rise further.
Our next question is for Lisa Yuzda, City News. Please go ahead.
Oh, hi there, Minister. You mentioned, to Rob's answer about the shots for 50 plus, and you're like, oh, of course, that's exactly what we're doing. But what most of us hear is that if you're under 70, and you haven't been CEV and you haven't received 2 AstraZeneca shots, so that's the most of the population, will get theirs between 6 and 8 months. But we're hearing from Nancy today it should be at 6 months, and not really hearing specifics of how you're going to change the plan so that people aren't waiting until 8 months, but are in fact getting it at 6 months.
Well, Lisa, what I'm saying are just the facts. The facts are 6 months ago, 209,000 people had received their second dose. The facts are 470,000 got their booster dose. We're factually ahead of schedule. The reason why that's been disproportionately people clinically vulnerable, disproportionately people over 70, is they got their second doses first. Remember, I'm not in the category of clinically vulnerable people who gets a booster dose, but I'm clinically vulnerable. I have type 1 diabetes. I received my second shot on July the 13th, so I'm not at 6 months yet. It's the second dose, and I think this is where when people have a memory of when they got their dose, it was April or May or something. That's the first dose. So we're delivering on that, and we've laid out the plan in detail. We were going to get ahead of the curve right now, and we are. So you see that more booster doses than we had second doses 6 months ago by a factor of 2 times. And that we're going to continue to push ahead by increasing our capacity of our system. And how are we doing that? By adding hundreds and then over 1,000 community pharmacies in the next little while. So we're going to meet the test practically on the ground. So I'm not sure. We laid out our plan in detail. It's supported by the NACI recommendations, and we're going to continue to proceed. And you asked what's our plan to increase resources to meet the large number of people who got second doses in late June, July, and August. Well, we're saying that. We're continuing our community clinics, which will be very much focused on those 5 to 11. Then we're increasing our capacity in the community to deliver booster doses. So I'm very pleased with how it's going, practically speaking. And the fact that Ontario and Alberta have announced more recently what their plans are, and we put our plan in place some time ago, is great. I think their plans align with what we're doing as well, and we're just proceeding. And the recommendation is at least 6 months, and you know, as a practical matter, we'll be working to send out notices 6 months after second doses.
Lisa, did you have a follow-up?
I do. Regarding the changes to 911 and people, you know, some people will be put on hold while they're waiting. We heard a great deal of concern yesterday. I guess, what do you say to those people who are, you know, feeling very worried that they're going to call for help and be left listening to music?
Well, the ECOM system is run differently, but so why don't I speak first about ambulance dispatch? My response is that we're responding by meeting the need, by adding dispatchers. 30 already, with another 35 coming, and more after that to meet the dispatch needs on the ambulance side, because that's critical. That if your circumstance is life-threatening, there is a direct transition that occurs. So the possibility of being put on hold is for non-life-threatening illness, and essentially it doesn't change when the response will be. It just means you'll be on for some time. That's a decision that's made by ECOM, because they want to provide better service on police and fire. But the response you see today, more ambulances, more paramedics, more dispatchers, enhanced scope of practice for ambulance paramedics, and yes, for firefighters and other first responders, a renewed ambulance service. And you see that the commitments we made in July have been followed through on. So that's my response, is that when you call 911 and need an ambulance should be on the way. And we've transformative increase in funding of our ambulance service since 2017, from $424 million to $559 million. We assessed, because of the increase in call demand, especially our most serious calls, that we needed more, and we are responding to that. And I'm very proud of Jim Chu and Leanne Heppel, who have led this effort, and the ambulance paramedics of BC have been a big part of it as well.
Our next question today is from Richard Sussman, Global News. Please go ahead.
Hi.
Prime Minister, thank you so much for doing this. Will a 52-year-old who is not clinically extremely vulnerable, who has not received 2 shots of AstraZeneca, get offered a booster shot 6 months after their second shot?
I think the recommendation is at least 6 months, and I think the answer is yes. We're ahead of schedule, and we're moving ahead. Yes, the priority has been people over 70 because they got their second doses first, and because they are the most vulnerable, and we see that in the numbers. But people in their 60s are also vulnerable to serious outcomes from COVID-19, and their priority as well. And that's why we're dramatically expanding not just the talk of it and the guidelines and the strategy, but the actual number of people delivering immunizations in BC, COVID-19 immunizations in community pharmacy. That's what we're doing, and I think it's been going well. We're very significantly ahead of schedule. We're going to be tested in the next couple of months, and I think I'm looking forward to us meeting that test. And if I may add that I think it's important just to people make sure for that 62-year-old and everyone else that they're registered to our system. For the most part, people are. There's some people who got in the earliest days of first doses of COVID-19 pandemics, they might have got the vaccine and not be registered in the system to make sure they're registered in the system. They can do that on our Immunize BC website and on the Get Vaccinated website, make sure that they're registered, and or they can call 1-833-838-2323.
Richard, did you have a follow-up?
I do. The College of Chiropractors voted earlier this week, 78% of them in attendance, to maintain the right to medical freedom of choice around vaccine. We know the province is looking at putting in a vaccine mandate for the extended healthcare sector. Are you worried that there's going to be a pushback from chiropractors? What would happen to a chiropractor who refuses to get immunized? And, should we, with Omicron here, is there even more requirement to have these mandates in the extended healthcare sector?
Well, in terms of the healthcare system, I'm happy to say that overwhelmingly, just as in the public service, that people are vaccinated. So that number is 98%, and it's impressive. And the effects of the vaccine requirements are positive as well, and we see that, and everyone sees that in the decline in outbreaks in our long-term care system, in our assisted living system. So that they were the right thing to do is without question. That BC has led the way in Canada on this question is without question. And that the positive impacts of that, including on our healthcare system, are seen. It's not without challenges, but it was absolutely the right thing to do. We're working with the colleges now, and the provincial health officer is, to ensure that those vaccine mandates are extended to the wider health system. With respect to the College of Pharmacists resolution, there's no question that the resolution reflects the views of those chiropractors who showed up at the meeting. I don't believe they reflect the views of anything like the majority of chiropractors. And certainly it's my expectation you'll hear from the organizations that represent chiropractors about that, because I think they have been consistent, passionate supporters of immunization and a strong part as a community of healthcare professionals of our efforts to immunize people. There are some people who disagree, and their views were put forward at that meeting, and all I can say is, and I want to reflect on the arguments that were made at that meeting, that those arguments are disappointing and wrong. But we're working with the vast majority of health professionals who clearly support immunization, support following the science of healthcare, and I think that the chiropractic community has demonstrated its support overall for vaccination, albeit there's obviously some chiropractors who hold a different view, and regardless, the rules are going to apply to everybody.
Our next question is from Mira Baines, CBC. Please go ahead.
Minister, my questions were asked, but I need answers in French, so I'm just going to repeat a couple of the questions that were already asked. This week, 911 call operators were told to disconnect from calls while they waited to be connected to ambulance. The union says this is putting people at risk. Why are people being left to their own devices in their most desperate moments, and what are you going to do to correct this problem?
Premièrement, c'est pas le cas. Qu'il y a une décision par ICOM de changer quelques opérations dans certaines catégories d'appels à ICOM de 911. Et je pense que c'est une stratégie pour assurer une réponse plus rapide, surtout pour des services des incendies, des services de la police. Donc, ça, c'est une décision par ICOM qui est dirigée par un consortium des municipalités. Cela étant, ma réponse, c'est d'augmenter la capacité du système des ambulances de répondre rapidement aux appels. Et c'est ce qu'on est en train de faire. On a embauché 30 dispatchers dans le système déjà depuis ma présentation du 14 juillet. Et deuxièmement, et c'est important, on va ajouter à cela 35 de plus d'ici le commencement de l'année 2022. Et on va continuer à entraîner des gens pour assurer une réponse plus rapide. Donc, si c'est sérieux, si c'est un moment où une vie est en cours, la direction, c'est direct au dispatcher d'ambulance. C'est pas il n'y a pas un délai et ceci ne va changer en rien la situation des gens dans ces circonstances. Dans certains appels non urgents, il y aura une période où des gens doivent attendre. Ils doivent attendre de toute façon, mais ce qu'on est en train de faire, c'est de réduire en général ce temps d'attente parce que c'est essentiel de répondre rapidement à ces situations. Donc, c'est l'action pour des gens qu'on est en train de faire et ces actions va avoir pour résultat une amélioration des services d'ambulance dans la province.
Mira, did you have a follow-up?
Yes, and again in French. Minister, can you just tell us about the timeline for Omicron in terms of booster shots for 50-year-olds? When can we start seeing that happening here in BC?
C'est en train de... on a annoncé cela il y a quelques semaines maintenant que notre cible, c'était 6 mois. À 8 mois, mais 6 mois. Et on est en train, je pense que 470 personnes ont reçu leur 3e dose. Il y a 6 mois, c'était 200 000, je veux dire 470 000 gens ont reçu leur 3e dose, alors qu'il y a 6 mois, 209 000 personnes ont reçu leur 2e dose, avaient reçu leur 2e dose en ce moment-là, et au commencement du mois de juin. Donc, on a mis en place notre stratégie il y a quelques semaines, et cela marche. Et c'est en train de marcher pour des gens en Colombie-Britannique. Donc, on est avant des autres à cet égard. C'est pas une critique des autres. Ça veut dire qu'on a agi quelques semaines avant le NACI et on a mis le système en place et ça marche très bien. On va augmenter à ce système des pharmacies et cela va ajouter à notre capacité d'avoir cette campagne pour les 3e doses et notre campagne pour les enfants de 5 à 11 ans. Et on est en train de présenter d'administrer ces vaccins maintenant aussi.
We have time for one more question. Our last question today is from Sinjan Alexander, CTV. Please go ahead.
Good morning, Mr. Dix. I'm looking for commitment here if we can. You mentioned hiring more paramedics. How many more are you going to hire? And I'm not talking about taking somebody who's part-time and making them full-time and calling it a hire. How many more are you hiring? Are you committing to putting more boots on the ground, more bodies in the team that's desperately needed, and how many?
First of all, the vast majority of paramedics in BC were on call when I became Minister of Health, not full-time, part-time, on call. And the move from that to a full-time service is important, and that's why we've massively increased our investment. So when you say making something a full-time job as opposed to a casual job is not an improvement, that is just simply incorrect and is not to be dismissed. It's an important part of what we're doing with the ambulance paramedics of BC, and we're doing it because the nature of the province has changed, and we need to provide that service everywhere, and that's why we've gone in 24 rural stations, and not so rural stations, to that model, to our model, which is, and in 23 other communities as well. We've added, not talked about adding, added 85 positions now, and we're going to continue to add as required. We've added dispatch positions now, and as I announced, we're adding more dispatch positions as are required. So what you're seeing is a transformation of the system in two ways, from a largely casual system and part-time, historic change in how we organize the ambulance service in BC and the BC Emergency Health Services, and that's been a process that we've put in place and sped up dramatically since 2017, and we're hiring more people as well. And I've just reported on that, I think that the answer is that both need to happen. We need to train and add more paramedics, and we need to create more full-time positions, which assists in recruitment of said paramedics, doesn't not assist. And when you have, in some parts of the province, only casual staff and your full-time jobs are all in the large centres, you're going to see, and you see consistently, a movement of people into those full-time centres and a problem with service everywhere else. And that's why we've made these changes around the province, so that whether you're in Revelstoke or in Vancouver or wherever you are, you'll get more service. And in addition to that, we've added significant air ambulance service since the beginning of the pandemic. And of course, that has been pressed into service dramatically with the 150, I should say, critical care transfers that have gone from the Northern Health Authorities to other health authorities in recent weeks.
St. John, did you have a follow-up?
Yes, please, and thank you. So then, Mr. Dix, can you commit now? Heaven forbid we have another heat wave like we did this year. And we know what happened. We know the delays, and we know, unfortunately, what happened. Can you commit to the changes you are making, that if we, heaven forbid, have another heat wave, that we will not see the delays that we saw, that people who need urgent care will get it?
Our commitment is to do that every day, Sinjin, not just in the most serious circumstances, the exceptional circumstances that had been once in 200 years and now are just once in 1 year. And so we have to meet that test, but it's also the test every day. I think the challenge of BCEHS isn't just weekends and periods like the heat dome weekend, but the fact that our highest acuity calls have gone up regularly on a regular basis. So we had the third highest day of ambulance calls in the history of the BC Emergency Health Services in the first week of June. This wasn't the heat dome. It was the first week of June. It was in third place behind what was New Year's Eve 2017 and New Year's Eve 2018, which were the previous record holders. Obviously, those records have been broken now. I think several dozens of the most significant days we've ever had have happened in this period, really in the period post-third wave of the COVID-19 pandemic. So we got more ambulance calls, and we have more serious ambulance calls, and that's why we've moved to address them by adding ambulances, adding ambulance paramedics, adding dispatchers. And so, but I want to add this with respect to response and being more resilient around the heat dome. It is not just about ambulances. It's about having more resilient communities, about making sure people know what to do in those circumstances, about addressing it in our housing, about addressing it in the creation of parks in communities and other things that help us deal with and become more resilient to the impacts of climate change. So while the ambulance service gets a lot of attention, and ambulance paramedics and firefighters responded with enormous dedication and effort to unbelievable circumstances on that weekend. It's not just this is not just an issue for BC Emergency Health Services. It's an issue for both government and communities well beyond it. And I think lots of those actions are taking place as well. But all of the things that we said we'd deliver in the middle of July, we're moving to deliver or have delivered. And that's because of the great work of our team, of our leaders, Jim Chu, Leanne Heppel. It's because of the leadership and the work on the ground on scope of practice that Ryan Sinden has done. It's because of the exceptional work of the ambulance paramedics of BC, QP Local 873, and because of the work of firefighters and other people who are so important, and all those who are doing first responder work in BC and have dealt with this year, what we dealt with in the last few weeks, and wildfires, and the heat dome, and COVID-19, and the overdose public health emergency, all at once. And I'm very proud of our teams and the work that they've done.
That's all the time we have for today. Thank you, everyone, for joining.
Thank you.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.